It is. Deaths in our small island. Have we lost control? The vaccine campaign must become more robust and effective. The Medical and Dental Association has made its case clear to the administration. Something decisive must happen urgently and now. Our nation is looking for leadership at this critical hour. This has been too little for too long. Prime Minister P. The science was clear before July, and it is still clear now. We need more urgent action to save our population from further harm and grief. I thank you.
Thank you very much, Mrs. McIntyre. for such a very passionate plea on behalf of thousands of our citizens who continue to be impacted by this deadly virus. I now turn over to Honorable Mary Isaac, former Minister of Health, and who has been in the media speaking a lot on the situation of the pandemic in recent weeks. Senator.
Thank you, Senator. Good morning. Good morning, St. Lucia. Good day, everyone on the panel. Good day to our fellow citizens at home and abroad. We have just heard from the former President of the Senate on the mismanagement of by this administration of the COVID-19 pandemic. It is clear that this pandemic is out of control in St. Lucia, given the fact that we were able to manage the virus, where we had, of course, one death is one too many. But when we demitted office, we had 88 people who had deceased at that time. Within a matter of 2 months, this administration came in and they discontinued most of the protocols that we had put in place. And they took a long time to decide on what new protocols they were going to implement. COVID-19 is very dynamic. If there is one thing we have learned over the past few years, it is that it is moving with a lot of speed, it is mutating, and there is no time for us to sit on our laurels like what this government did to determine what is the next step, instead of continuing the steps that were already in place. One of the, what we are hearing is that this phase of the virus is much worse. But we've always known that the phases coming would have been worse. We were warned by WHO, we were warned by PAHO. There was a lot of information for us to have taken into consideration in determining the way forward in terms of managing and controlling the virus. But instead, the government came in and decided to discontinue the protocols, just to show their disagreement with what we already had in place. But of course, every St. Lucian knew that that was working. It worked for us and it was working at the time. So now we have seen the level of mismanagement that has taken place. And as a result of that, many of our citizens have died. I say that these deaths are on the hands of this current administration. It is very sad that at a time when we are going through a pandemic, the administration took it on itself to play politics with something that is so important as human life. St. Lucians, they used to say you need to watch your bread, but this is the time you need to watch out for your life in this country, because we have no leadership in this current administration. And they are looking at COVID-19, they are treating COVID-19 with a piecemeal approach. Day by day, let us see who else is going to die, let us see what is going to happen, and then we will decide what we put in place. Our administration, the former administration, had vision. And we used that vision to put the necessary protocols in place so that we could protect the lives and livelihoods of the people of this country. Now we are being told about sheets that are changed at the hospital. We are told that sheets get changed at hospitals all the time. We constantly had to be purchasing sheets. We don't come to the public and talk about sheets that we purchase for a hospital. And then we heard about the contact tracing team, that it has been augmented or more people have been employed. But that is only because so many of them have contracted COVID-19 and they've had to be isolated. They've had to be quarantined. Therefore, there was the need to replace, to add to that cadre of individuals. Also, we have nurses, additional nurses and doctors. But we are not told that it is because the ones that are there are so frustrated, not knowing what is going to be in place tomorrow, what protocol is going to be in place tomorrow. And therefore, they are very fearful for their lives because they don't feel protected by the government of the day. And they are taking off. They are taking off in numbers. And that is the reason why more of them are being employed. We heard about oxygen that was supplied from a neighboring country because they ran out of oxygen. X-ray machines, of course, we know that equipment is going to run out. The Victoria Hospital is not a new plant, and therefore there will be the need to change equipment every now and then. When I left the Ministry of Health, we left a list that was sent to both Martinique as well as Taiwan of what it is that St. Lucia was looking at that was critical for us in terms of getting assistance from friendly governments. And on that list, I know we had X-ray machines on that list. So for the current administration to be bragging about them bringing an X-ray machine to the Victoria Hospital, at this point in time, that is not what is important. We know that hospitals need equipment and they will be re-equipped whenever necessary. My administration spent millions of dollars purchasing equipment for St. Jude Hospital, for OKEU, as well as Victoria Hospital. So I am calling on this government to focus on saving lives, saving the lives of the people of St. Lucia, putting the proper protocols in place and doing so speedily so that we can continue, we can try to save as many lives as possible. Brothers and sisters, citizens of St. Lucia, the situation is critical. The situation is dire in St. Lucia, especially for our frontline workers. We've heard of the number of police officers that were infected. And as you know, our police force is crippled as a result of that. So we need this government to take the necessary steps so that we can feel protected in our own country. I thank you.
Thank you, Senator, for such a passionate plea and very, very informative presentation coming from you, where you highlighted a number of areas that leave a lot to be desired. It gives me great pleasure now to call on our political leader who will address this gathering this morning. I want to introduce to you Honorable Alan Chasney, the MP for Micoud South and the political leader of the United Workers' Party, our former Prime Minister, Honorable Alan Chasney.
I think PM's.
Sorry about that. Let me, is that better?
Yes, we can hear you now.
Great. I want to thank you, Dominic, for hosting the meeting this morning. I also want to thank Madam President and also the former Minister of Health, Mary Isaac, for their very good presentations and really set the foundation for the discussion this morning. And before I begin, I just want to express my sympathy to the families that have lost loved ones. And sometimes we only really focus on those persons who've lost loved ones, but the thousands of people who have been in households in which a family member has been affected and are going through the frustration of not being able to access any form of medical care. It's a distraught situation, it's a distressing situation. And it's one in which, while we were in government, that we focused heavily on, that we did not want to see a repeat of what happened in Italy and what happened in England and what happened in New York City and many other countries around the world, where the numbers of infected people overwhelmed the system. And that's exactly what we have here today. So not only are we losing persons unnecessarily, but many families are being affected and are going through the added stress of not being able to get a family member into the respiratory hospital, to get timely intervention from doctors, and certainly are surviving on prayer. Prayer is very powerful. But in these circumstances, particularly with persons who have underlying conditions, it's very, very difficult. When the government changed, and again, we have a very democratic process and solution, one that our party adheres very much to, I have to say I was a bit taken back by the initial pronouncements by the government, because the new government would have been the beneficiary of not only watching what we had done as a government, but what the region and internationally had taken place. And it boggles the mind that a new administration coming in, particularly with the election activities, would not have understood that there was going to be a potential for a significant outbreak. And when one takes into consideration the Delta variant, because we knew the Delta variant was already in the region, we knew it was a matter of time that it was in St. Lucia. And in fact, many of us suspected that it was already in St. Lucia. So it makes the decisions by the government when they first came in even more irresponsible. And within 30 days, and we saw the uptake in cases, that the government still did not address the situation sufficiently. As pointed out by Madam President, the infection rate remains anywhere between 25 to 30% on a daily basis. This is the core issue, is the infection rate. And the protocols that you put in place have to take that in mind. And the success of those protocols is measured by reducing the infection rate. In January of this year, when the active cases had reached almost 1,100 following the Christmas and New Year's break, it took us 4 to 5 months to bring the active cases back down to 50. And that was with a clear understanding. To do that, you have to reduce the infection rate. If every single week the number of people being infected is growing, because it means that there are more people who are carrying the virus. So if it's 1 out of every 4 people that they're going to infect, it's just a matter of numbers to say that you're not going to solve the problem. After 50 days and seeing that we had surpassed 2,400 active cases, and we seem to be on a very fast pace of deaths, highlighted by the 2 previous speakers, where we're saying in 18 months we had 5,000 cases and 85 deaths. And now within 50 days, you have over 5,000 cases and 111 deaths, and still counting. And there's no relief in sight. That this is a disaster. This is when we took pen to paper, and I wrote a letter to the Prime Minister, a very lengthy letter, giving him the benefit of the experience that we had, talking about that lives and livelihoods is a very delicate balance. That if you don't deal with the lives, then it means that the actions you have to take to save lives becomes more draconian. And those draconian policies has a very negative impact on our financial situation, one that is very precarious. Last night, the Prime Minister addressed the nation, and I'm not celebrating that he actually validated and vindicated the United Workers' Party. So this big lie that was perpetuated on the people of St. Lucia, that United Workers' Party was irresponsibly spending money, and that we were not a caring government, was unveiled last night. Fact is, we only were able to borrow $300 million. And as outlined in the letter that I sent to him, there was almost a $500 million deficit. The remaining amount of money came from the overdraft facilities and payables. and that the $300 million was used to pay for salaries, to help pay debt, and to pay for supplies for COVID, all related to COVID. Because of COVID, the shortage of revenue put in jeopardy our ability to pay wages. And this was very well expressed even as early as February of 2020, when we had negotiations with the unions in an attempt to be able to solve that problem. The Prime Minister also made a very important point, that now with the Delta variant, and more importantly, that we expect new variants in the future, that the only solution to this problem is for people to become vaccinated. We understood that from early. And the reality is, sourcing of COVID supplies, when we go back even into 2020, trying to get ventilators, trying to get PPEs, and competing on a global basis was difficult. And sourcing of vaccinations was even more difficult. When I made the statement as the Prime Minister that we were going to decide on the final date of the election based on the vaccination programs, many people, some of the people in the room today, criticized me, indicating that our government was trying to prevent democracy from taking place. I hope that you now realize that what I was saying was true. It's exactly what we had to do. And I did everything I could possibly do to get vaccines, including participating with Barbados and the Bahamas in trying to procure vaccines. Sadly, didn't arrive. And we'd given ourselves a deadline date of the end of June. And we did have a contract in place so that if in fact we did not get the vaccines, there would be a mechanism so for us to be reimbursed. My understanding is that mechanism has already begun, and the vendor is already sending monies to reimburse St. Lucia. So there would not be any loss, financial loss. But the reality is that we needed to get vaccines. And we had many vendors coming to us. So when this opportunity came, and our due diligence was that they were in touch with AstraZeneca, and we knew that this was a legitimate possibility of getting the vaccines, and also knowing that colleague countries were participating in this. And more importantly, that the individual representing the group, Mr. Mark Maloney, is not an unknown individual to us. He's a successful businessman in Barbados and has done business throughout the length and breadth of the Caribbean. And he does business in St. Lucia. And more importantly, he has assets in St. Lucia. So I always knew that if in fact that anything went awry, the government of St. Lucia would always have the ultimate ability of recovering whatever monies that we put in. But I have to say, it was extremely frustrating as a prime minister, as it was for many of the other prime ministers, of the continual promises by COVAX of a date of arrival, the letters that we wrote to heads of government throughout the length and breadth of the world, and being told no. And we now know for a fact how long it has taken to get the vaccines here into St. Lucia. And so it would have been well short of the deadline that we'd established for ourselves, because democratically or constitutionally, we would have had the election by October 15th. So I'm very saddened that we were not able to get more vaccine in place to protect more people in St. Lucia. But nonetheless, the protocols are there. We're seeing on a continual basis with this administration, the reference to science. I want to remind us that the same people that are advising the current administration were advising my administration. So how is it that the same advice is being interpreted and implemented differently, and with such dramatic differences? So we were getting the advice, we interpreted it the way we felt it was to be interpreted. We implemented policies based on that interpretation. And as a result, after 18 months, we only had 5,000 cases and sadly, 85 too many deaths. This administration is getting the same advice and somehow is interpreting it very differently, implementing a very different policy. And in 50 days has over 5,000 cases and over 111 deaths. And that's why I've said that there are two sciences that we need to follow. One is the economic science and the other one is the health science. And in the health science, it is actually very simple. The infection rate. The infection rate is the key to this problem. Even the statistics that the Prime Minister cited last night confirm what we know. That the people who are getting infected are people who are practicing in social activities, and particularly social activities that have alcohol. That was the key to our success. Curfews and limiting social and mass crowd activities. And that's exactly what we've been recommending to this government to implement as quickly as possible. The other fallacy that is coming through is that this situation does not allow you to have one policy for everyone. We have seen that the infection rate in businesses, in the hotels, places that are organized schools, this is not where the problem is. Very limited infections are taking place in those areas. So having a separate policy and protocol for the tourism sector is necessary. Tourism is an industry. It's an industry that invites people to our country, and we have to have a product that can be competitive. And why is it necessary to do that? Because of the economic situation. We cannot afford to have people unemployed. We cannot afford to have the country shut down. And the Prime Minister alluded to that. That's the balance. Keeping your construction going, keeping your back of the office operations, your call centers going, keeping the manufacturing sector going. It's incredibly important because in the absence of that, it causes an economic crisis which will undermine the ability of the country to provide the healthcare services that are needed. And it will undermine all of the other services the government needs. As the Prime Minister alluded to, and we knew that, there are no other concessionary funds to be had. The World Bank and the IMF gave us 100% of the allocation that they had. And they followed up to make sure that we spent the money the right way. So we've now found ourselves in a quagmire. The quagmire is that dimmer switch that I spoke about all the time now has to very much favor the health science, and it's going to be at the expense of the economic science. And if this government does not quickly address the direction they're going in, we're going to fall into the abyss. Instead of taking the advice as being good advice, the government has decided to play its typical political science. I found the Prime Minister's address last night, and in particular, his letter, his response back to me on the letter that we wrote, as being irresponsible, irrelevant, and insensitive to the current crisis. And sadly, it confirms in my mind that the government continues to focus on the political science and not the economic and social science. I'm going to stay online. I know that there are probably some other issues that the media may want to ask me, but I certainly would like us to focus as much as possible, not because I'm trying to avoid anything, but on the crisis that we have on hand, and that the government must act now. And many of the things that the United Workers' Party had implemented worked. And so for the sake of the well-being of St. Lucians, that is both from a lives and livelihood perspective, they were asking them to quickly address this situation, turn around what they're doing, and make sure that we're heading back in the right direction. And to reaffirm to them and to the public of St. Lucia United Workers Party will only be here to complement what the government is doing. And as I said, when we think that they're going in the wrong direction, is to say so. The decision to allow businesses and particularly restaurants to remain open only to vaccinated people is good. We were working on an electronic passport. I have not seen that come out. I'd like to remind the Prime Minister that that's something that needs to be expedited as quickly as possible, because it would become very difficult for those same restaurateurs to enforce the policy if there isn't a way of making sure that people actually have a genuine vaccination certificate. The ones we have on paper are very easy to replicate, and people have actually been replicating them. And this means it would undermine the enforcement that we have. And I also want to strengthen the point that Madam President made with regards to the custody suites. We had already made those amendments and made sure that instead of putting people in jail, that people were going to be fined, and trying to put an expedited court system in place so that people would have to pay that fine much quicker. But every administration is allowed to amend what they want to do. I just want to say to the current administration, what you're doing is not working. It is undermining the viability of our country, and we are heading into a catastrophic period. And if in fact they continue going, it's going to be very difficult for them to continue to meet all of its obligations. United Workers Party found that balance. We paid all the wages. We paid for all the debt that came due, including the bonds that were being redeemed. We continue to supply resources to the Ministry of Education, to the Ministry of Security, to the Ministry of Health, and to our social programs. And it was irresponsible on their part to say to the public of St. Lucia that somehow there was a whole heap of money that we had access to, and we were not using it to beef up our social programs. I came on many times and it said it pained us that we could not do more, but it gave us even more drive to make sure that we keep the numbers, contain the numbers, so it was the effect on people would be minimized. So again, I thank you for this opportunity. And again, I call on the current government to change the direction it's going in. Put the people first, follow the science, which is the economic and health science, and stop playing politics.
Thank you very much, Mr. Political Leader. We do concur with a lot that you have said. The address by the Prime Minister last night, which was supposed to have put the nation at ease, I believe it has made us more confused and made us all more afraid of our lives, because we heard nothing new. We saw nothing from the Prime Minister. He spoke about changing the names of organizations. He spoke about improving Wi-Fi. Those, cosmetic issues don't do anything to reduce the number of cases that we have. What we need to do is get down to the bare bones of fighting this pandemic, and to make sure that we do the very best so that we can prevent more people from dying. We see in the presentation from Mrs. McIntyre that the number of individuals that died in the first 18 months of the pandemic up to the end of July was about 88. Come 2 months after that, we are now at 111 additional deaths. This really is strikingly dire, and we need to do something very urgently so that we can arrest the situation. I know that members of the press are standing by, and I know that you are here waiting to issue your questions. We're here to answer any questions that you may have on anything that was said, and we're all available. So please indicate if you would like to ask a question by raising your hand. And just for the benefit of our viewers that are watching live, please indicate your name and the media house you're representing. So the first question comes from I don't see any hand up. Maybe there's no interest in questions from the media.
Sorry, Mr. Fede, I'm trying to raise my hands and can't find where to do that.
I take it that this is Janika Simon.
Yes, sir. May I go ahead? I'm
Yes,
sorry,
please.
I didn't raise my hand.
Yes, please. Ms. Simon, are you there?
Hi, can you hear me?
Yes, yes.
Oh, sorry about that. Okay, let me start over. I had a question for Mr. Chasney. I'm trying to figure out more information about the due diligence process that was conducted when St. Lucia decided to go ahead and contract with Radical Investments to obtain these AstraZeneca vaccines. I note that in the information that has come out since the lawsuit was filed, the British High Commission actually had written to the government of Barbados to indicate to them that AstraZeneca never did business with private companies, that they only did business to governments and government agencies. So I noted that Mr. Chasney had said that our due diligence process indicated that the company was in contact with AstraZeneca and could get these vaccines. So I just want to clarify what due diligence steps were actually taken, especially since the Prime Minister had previously indicated to Barbados Today that he did not know the company Radical, that he only knew Mr. Maloney. So from the Ministry of Finance perspective, some insight on the due diligence process at the time.
Mr. Political.
Yep, thank you very much. So we always knew that that was the case, that a private company could not source directly. In this particular case, I want to reiterate, St. Lucia is not the one who went out seeking Mr. Maloney or Radical. Radical approached us, indicating that they were working on purchasing 1 million vaccines and that they had 2 other countries that were participating in it. We also understood that the one country would be taking the lead with AstraZeneca directly, so that basically AstraZeneca knew what the role of the Radical was going to be in this process. In fact, there was another entity which was called Serum that was involved. The lawsuit that Radical has in Miami was before our time, and they were trying to recover monies in a different attempt. So we did know that it was being done from government to government. We knew that the communications between those entities had been taking place. And we also knew that some of the delays, so for instance, when we first signed up, almost immediately afterwards, you had the breakout in India. And priority now was given by AstraZeneca to India. Then there was a breakout in the European markets, and many of the European countries stopped AstraZeneca from exporting. But yet we continued to persevere. The other part of the due diligence that was done, Janika, was that there's a contract. So there was a contract negotiated that brought all these terms to light as to how the money was going to be transferred, where it was going to be transferred, and what the level of accountability was going to be on the entire process. That was vetted by the Attorney General's office, and the procurement process was gone through within government. And I hear these allegations that there was a handwritten check. I mean, this needs to stop. We saw leading up to the elections what I call the big lie, very clear allegations that are false, easy to be able to verify. That is a categorical lie. Fact is, the money was transferred electronically to Radical's account. The other thing is that since all of this has been taking place, Radical has been working to reimburse St. Lucia. My understanding is some of that reimbursement is already on the way, and within the next couple of weeks or less, that the full amount would have been reimbursed to the government of St. Lucia. So I think that due diligence that we did worked. The fact that we had a contract in place was a testament to the fact that this was not being done secretly. I came out in several statements publicly to pronounce that we were working on getting the vaccines, that we were working with 3 other countries, because it's impossible for St. Lucia to buy 1 million vaccines by itself.
Okay, Ms. Simon, I know you have a follow-up. We'll take Nelsia Shalmine after your follow-up question, and then Sheffield Gaylord from Blue. Ms. Simon.
Okay, thank you very much, Mr. Fede. Just to follow up on that, I wanted to find out if I'm understanding correctly, Mr. Chasney, you saying that Barbados was the one who approached us to join in so that we could get this minimum vaccine quantity, because I understand that the minimum you can buy is 1 million. So if that is actually the case, then why were we the ones to pay Radical and Barbados did not advance any funds? How did that, what was the decision-making process there?
So it was not Barbados that approached us, it was Radical who approached us, indicating that they were working with 2 other countries to purchase the 1 million. So
okay, sorry about that, my misunderstanding, but I think the question is still stands, that there were 3 countries that were in this deal. The Prime Minister of Barbados said that their agreement with Radical was payment on delivery of the vaccines. My questions to the Bahamian authorities have not revealed any knowledge of such an agreement with Radical. So it seems St. Lucia was the only people to actually pay money. So why was that the decision, and not like in the case of Barbados to tell them, well, we'll give you the money when we get the vaccines delivered?
I did confirm that the countries were involved, but you would understand that there is certain private information I was not privileged to ask. So the details of the contracts and the arrangements either one of those countries had, other than establishing what the price was going to be, I did not know. I knew that because they had approached us to get 300,000 and now we were only getting 100,000, that paying the money did not seem untoward at the time. I was also satisfied that the contract that we had put in place would have covered St. Lucia. I was further satisfied that Mr. Maloney, who headed up Radical, was not an unknown entity. As I said, established businessman in Barbados, had done business in St. Lucia, and more importantly, owns assets in St. Lucia. So that if at any point things went wrong, I knew that the government would have had a recourse. But I am very happy to know that the faith that I had in Mr. Maloney and in Radical was well-founded. And the fact that they have started the process of reimbursing St. Lucia. And I want to applaud Mr. Maloney, who did not have to do this, from what I understood. And here's the big thing in terms of why did we give a direct reward? They approached us. They're the ones who had a deal on the table. And we had been attempting, we had written letters to Prime Minister Boris Johnson, in which he wrote back to say he could not help us. We had thanked Prime Minister Modi, but when he had his crisis, he could not provide any more. Initially, Canada and the US had indicated they would not be giving us, or the region, any vaccines. So I think you have to put it in the context of that particular time, Janika, is that we could not get vaccines. I had a very hard deadline, which was called elections. And I knew that if in fact we went into elections, and certainly the sentiment on the ground that somehow the United Workers' Party was trying to avert democracy, that it was going to be very difficult to contain people in wanting to express their democratic right. I also knew that it would cause an increase in the affection rate in St. Lucia. And this is what we had been trying to avoid. And I'm on record saying that. It's sad that the relationship that we had, particularly with the media and with some members of the general public, that it reached a point where people didn't think that that was credible and that we were trying to make an excuse. But now in hindsight, all of these things are now starting to unravel. And you can see that our government acted responsibly to all these issues.
Thank you, Nelsia Shalmine. Nelsia Shalmine, Choice TV, do you still have a question? Okay, maybe not. Any other questions from any other member of the media?
Nelsia just said she's trying to join, Mr. Fede.
Oh, she's trying to rejoin.
I have another question in the meantime.
Oh, sure. Go right ahead.
Thank you. Let me take advantage of my colleague's inability to communicate. Oh, she says she's going to send the question in the chat and I will ask it for her. So I'm just waiting for her to send the message, but I'm going to ask a question to Miss Isaac. Okay, she's still here. The Delta variant was confirmed in St. Lucia. The news reports came out on July 15th. So I'm assuming that health authorities may have gotten that report from CAFA 1 or 2 days before July 15th. So given that in mid-July, we knew that Delta was here in St. Lucia, we also knew from the WHO, the CDC, etc., that it was believed to be several times more transmissible than Alpha or the wild strain that we had originally. Why, or can you talk me through the decision-making process by the CMO, everybody in the command center, to continue to allow election-type activities, including rallies and motorcades, knowing that we had Delta in the country, it was much more virulent than anything that we had seen before, but we decided to go ahead with our election season anyway. Talk me through that decision-making process.
I am not aware that at that point in time that I was informed that we had the variant on island for sure. Because you see, when we send the test to CAFA, it takes a while before they come back. And by that time, elections had already taken place and we were out of office. It is immediately after elections that I found out.
Let me just correct you, Ms. Isaac. I said that the news reports confirmed the presence of Delta in St. Lucia on July 15th.
Which would have been in the middle of an election campaign. So
that's right.
Would have been made way before confirmation of the Delta variant, Ms. Simon.
And just to add, so because I was very much involved.
21 days before its July 27th date. So
that's right.
Therefore, we could not have known that there was a Delta variant before making those decisions. Those protocols were actually decided upon by the United Workers' Party and the St. Lucia Labour Party. They had the moral obligation to say no, that we're going through the middle of a pandemic. But what they did, Janika, is that they fought us at every step of the way. When we said, let us not have marches, let us attempt to have our politicking in a way that is virtual and responsible to the health of the people. At every step of the way, go back and look at the SLP's march and you will see, the banner says, there is no COVID in St. Lucia, when we were saying to them that our population was at severe risk. And so therefore, I think that would be an unfair question because the date of the elections were announced way before and the protocols would have been decided upon way back in June would be the correct answer to that.
If I can just add, Dominic, if I may.
Sure.
That in the middle of the election, only allowed community rallies, and again, everybody was being asked to adhere to the protocols as much as possible. But as I indicated, this election had been built up on the fact that somehow the United Workers' Party was trying to protect or prevent people from having a democratic right. And that was, to your point, Dominic, something that was perpetuated by the Labour Party. And it was very, very difficult. And it makes it even more to understand, it's more important to understand. And that's the sense of urgency we had in trying to get the vaccines before we announced the elections.
But also at that time, remember that we were trying to keep strict protocols in terms of people going out there and, you know, participating in the campaign. But we were listening to the CMO, and the CMO was strengthening the protocols as we went along, to the point where parties were told that they would be able to have certain rallies at certain times. And when she realized that, you know, we had to try to move in to protect spread, she canceled some of those rallies were canceled. At some point we were told no more island-wide rallies. So there were some steps taken and some measures put in place by the CMO together with the political parties to curb the spread of the virus. We were told that, I mean, it was, in terms of the Delta variant, we had sent the information to CAFA, but elections had already been called and that swing was already ongoing. So all we could do was to ensure that the CMO kick in and put the CMO as well as the Commissioner of Police put in more stringent measures in place. And they actually did that. So that was the most we could do at the time.
Well, I hope we answered your question, Ms. Simon. Any other thing from you on that matter?
Just one thing in terms of correcting the record. I noticed that you pointed out the banner at the rally. I just wanted to clarify for everyone who may be listening that that was confirmed to have been a Photoshop. So just for clarity's purposes, but I don't have any other questions.
Okay, thank you very much for doing that. You had a question on behalf of Nelsia Shalmine?
Yes, apparently she's unable to turn on her microphone. This question is actually not about COVID, but I think this is the first time that we are able to speak with Mr. Shastney, so hopefully he will take this question. I'm just reading verbatim for her. Mr. Shastney's absence has been noted from the House of Assembly on several occasions. Can he explain this absence and whether he thinks his denouncement of the way things are currently being run would seem more substantial if he were here on the ground? Furthermore, he has been asked to apologize to the people of his constituency for his absence. Does he agree that such is in order? That is from Nelsia Shalmine.
Mr. Political Leader?
You can give me 1 second.
Sure. So, going back to this issue, you said that was Photoshop. Was that announced by the St. Lucia Labour Party, or was that your own research, Ms. Simon? Just to
it was discussed, and I also found the original of the photo.
Okay, because also the Labour Party did indicate on the record, and I can show you video where leading members of the Labour Party, especially when we passed the COVID-19 bill, remember as well that we were fought vehemently to remove the state of emergency. And he said that the state of emergency was not necessary because they felt that what we were doing is that we were overreacting to the COVID situation that was in the country. So I find that extremely strange because it really is in keeping with the narrative that was sprouted by leading members of the St. Lucia Labour Party. But I have not heard any official announcement from them stating or denouncing that the fact that that banner was a Photoshop item. To me, it is in line with what they've been saying all along as it pertains to this pandemic. Everything that they have done has undermined the public trust in the officials, the public health officials of this country while they're in opposition. boycotting the passage of the COVID-19 preparedness. And all they have actually come in to do is to change the name of the command center and to change the composition. They've added the youth and they have made no changes. Again, what they have done is vindicated our approach to the whole management of COVID-19. And, you know, if you ask me, my opinion is that they have been a complete disaster on how they have handled things. And I don't know if you're among members of the public that share, you know, a lack of confidence in what they have done. But, you know, we're calling them to account, and this is what today is about. And they have put themselves in a quandary by being so irresponsible, disingenuous in opposition with the way that they have leveled with the people of St. Lucia. So now they have to go back to say, well, we shouldn't close the borders. I remember Dr. Hilaire, the now tourism minister, when we were looking to reopen the economy and the date was set for June 4th, he indicated that we were bringing death at the doorsteps of the people of St. Lucia. There was no Delta variant, there was the Alpha variant. And today they're using the Delta variant as an excuse for their weaknesses. And what is he saying now that we have the Delta variant? That we need to continue to operate the tourism industry. And so, I mean, forgive us if we seemed a bit peeved and we're not impressed with the disingenuous nature of the members of the SLP on a range of issues as it relates to the COVID-19 management. All of a sudden, the state of emergency, the prime minister, the former prime minister, now political leader, was saying that the only legal framework we have to institute a curfew is to have a state of emergency mechanism. By the way that we have conducted ourselves, we never seized anyone's building, we never seized the hotel. We worked with people and got them willingly to make their hotels available at quarantine facilities for both unvaccinated people and positive cases. Today, we have over 90% of our positive cases are home quarantining in less than desirable circumstances to isolate families. And these are the major problems. Coming on television in a national address as the Prime Minister to say that you have put Wi-Fi with Flow at Victoria Hospital, I mean, really is extremely shameful and disgraceful. And what needs to happen is that the Prime Minister and the government needs to get preoccupied with the fundamentals of managing COVID-19. We left a very solid foundation for them. They have tried to look at all kinds of different issues, trying to come up with excuses. I mean, there are enough ventilators, the testing capacity, which the Prime Minister spoke about last night, indicating that the testing rate went up from 187 to about 390 something. That wasn't possible back in January. Had it not been for our intervention to make sure that we beef up the testing capacity, both at Ezra Long and making sure that the forensic lab was mobilized, that if needs be, that they too could be joined in the PCR testing fight. The Prime Minister would be in a worse situation today with this fourth wave that the country is going through. So I say all of this to say that the United Workers' Party left the SLP a solid foundation. All they have to come and do now is to change the name of the command center to the National COVID Management Center. Is that going to bring down the level of cases? I mean, is that what we're coming on television to say as the Prime Minister? And there are so many issues that are affecting us. You're telling me that the monies that are borrowed, 167 million was mentioned among the monies that he claimed that were not for COVID. And 167 million of that amount was actually paid, used to pay the salaries of police officers, firemen, doctors, nurses, other health professionals, senior technocrats in the Ministry of Health. You're telling me that these people are not working directly in making sure that our country wins the fight against COVID-19, and those monies you're saying are not monies that was spent on COVID? I mean, come on. How far are we going to go with the politics? And the government needs to stop behaving as if it's the opposition. You are in government now, govern the country, run the country, take us out of this pandemic, and stop trying to raise all kinds of smoke screens to distract from your own failures. I mean, whether the former prime minister takes a vacation or not, and he misses a few sessions in parliament, what is that going to do to the pandemic? Why are they so in love with him all of a sudden? Get on with running the country. We have not missed anything. All of the bills that have been brought to the parliament are United Workers' Party bills. He's very much aware of what they are. We are in support of those bills. That's our work. The income tax bill, the IBC bills that they have brought are all UWP bills. So what is all this fascination about? Whether he's an island or not, he's going to be here. He's here at the press conference. He's committed to his job as leader of the opposition. But this is very, very early days yet. When we thought that we had an opportunity to give the government a honeymoon period, they have squandered the traditional honeymoon period. Now, we have to come up and ask and beg them and plead for them to do the right thing by the country to manage this pandemic well. This is not about politics. This is about our country. This is about making sure that we prevent more people from dying. Let us focus on the fundamentals and let us not get distracted by sideshows. Mr. Political Leader.
Thank you very much. I'll be very quick in the answer. First of all, when I left office, I left with over 250 days of leave due to me. The fact that I'm not going to be compensated for that time is irrelevant. I gladly give up those days of vacation while I was in office, and particularly with what was going on with COVID. In terms of attendance at Parliament, I've certainly not made any political statements that I'm boycotting Parliament in any way, unlike other persons who walked out of Parliament, and for me, are more guilty of abusing and avoiding having avoiding the responsibilities that they have to the general public. I think I've had a need for some rest, which I have gotten. It's been a very long time. My daughter just went into university, and it was a pleasure for the first time to be able to accompany her and into this very remarkable period of her life, and to spend some time with my wife and not to be burnt out, to go home and just, you're a zombie by the time you get home with the kind of pace that we were going at and the intensity of the work that we've had. I'm also using the opportunity to continue to further some of the difficulties that I have identified. I've spoken about the term that I call post-COVID trauma. And I've said that if we think that the COVID period has been tough, post-COVID is going to be even more difficult. None of us know the implications of the health implications to people who have actually been affected by COVID. And that's something that we're learning more and more about every day. And we've seen globally what's taken place economically. The price of fuel is going up, the shortages of supplies, the disruption in the traditional economic systems are going to leave a gaping hole, and certainly are going to continue to undermine the viability of our countries. And so I have been working with a group of people on a potential solution, not only for St. Lucia, but also for the Caribbean in that regard. So I very much take my representation very seriously, both as a rep of Micoud South, and I have a very good relationship with my constituency. The fact that I was re-elected in my constituency, I think should be testament to the relationship I have with it. I mean, and the work that we have done. And right now, it's farcical when I hear persons indicating that I've abandoned Micoud South. Well, those same persons whose government are in office right now go and deliver to the people of Micoud South the things that they have promised. That's what they need to do. Their government is in office, and exactly what Dominique said. Stop with all the politics. Stop acting like you're still in opposition, and go and govern the country. And we've given you the space and the latitude to do that. And that is what we'll continue to say. So I very much intend to continue to represent the people from Micoud South as long as they're going to have me. I will continue to be the leader of the United Workers' Party as long as they provide me with that level of support. But certainly I am very committed to St. Lucia. I'm very committed to my constituency. And I have making no political statements in my absence. I have on each occasion written to the Speaker of the House and to Parliament to indicate that I would be absent. So from a constitutional perspective, this idea that I'm in jeopardy of being evicted, please stop with this. The Constitution is extremely clear. Read the Constitution in terms of how this works and also the standing orders of Parliament. So until the Constitution remains the way it is, until the standing orders remain the way that they are, I'm not in breach of anything. And as I said, I want to remind everyone, in my mind, it was much worse to walk out of Parliament while a debate was taking place. Bradley and I stay in contact all the time. Dominic Fede, who heads up the Senate, and I stay very much in close contact every single day. So I'm aware of all the things that are taking place in St. Lucia. And this is why I've penned the letter that I did to the Prime Minister. And I do intend to pen several other letters to him about concerns the United Workers' Party has about things and decisions that he's made. And I will continue to make those opinions known to the general public. We remain very active in a very responsible way. This is a delicate period in St. Lucia's history. And what we don't need is the kind of behavior that the Labour Party had while they were in opposition, that continued to undermine the credibility of the government of St. Lucia. Not the United Workers' Party, the government of St. Lucia. And many of the allegations that were made specifically at me as Prime Minister were undermining the authority and the ability and the credibility of the government of St. Lucia that represents the people of St. Lucia. And the United Workers' Party will not practice that kind of politics. We will not do things that are going to undermine the reputation of our country. We will continue to abide by the rule of law and democracy, but at the same time, in a very responsible way. So when you read the letter that I penned to the Prime Minister, it offered real solutions. It didn't just make an allegation void of any practical solutions, and highlighted exactly the assumptions that were made in the decisions the United Workers' Party adopted, and in hopes that it would help him in adopting and putting into practice better protocols and better policies to solve this really unique situation that we find ourselves in right now.
Thank you, Mr. Political Leader. You have a question on behalf of Mr. Rick Wayne. Janika?
Thank you, Mr. Fede. Sorry that you all are hearing so much of my voice today, but my colleagues are contacting me, those who cannot come in. So Mr. Wayne has a question, and it is relating to the Radical Investments vaccine purchase. We heard Mr. Chasney say earlier that the lawsuit that was filed in Florida was before St. Lucia's involvement in the whole vaccine deal. So Rick is asking, if that is the case, why did we go ahead anyway to pursue this deal?
So that's information is not really true. I said to you that the engagement with the other company happened before the engagement with St. Lucia. I would not have known about that, and like the rest of St. Lucia and the rest of the world, only found out about the problems that they had with the other company when the suit was filed. So we like everybody else only found it at that point. But in speaking to Mr. Maloney, it was made very clear that was an activity that had nothing to do with the arrangements that were being made with St. Lucia and Barbados and Bahamas. It was a prior attempt to be able to receive a COVID. And this is how the company's serum, from my understanding, came into place. But again, I just want to say that we've been very transparent in what we have done. The idea that somehow, again, that I as Prime Minister acted without the authority of the procurement process or without going through the proper procedures is, again, false. We did all the due diligence that we could. We knew that we were taking a chance, because nobody had really been able to get the vaccines, but we felt that this was our best hope of getting the vaccines. And at no point do we believe that we have exposed the monies of the state. And I'm very happy to hear that the payments, the reimbursement payments, have already begun. And I'm told that it will be completed within the next couple of weeks. Again, the conspiracy theorists that are out there, this is false. There was no malintention. There was no behind the door activities that were taking place. This was a legitimate approach to solve a very big problem in St. Lucia, and one that was reinforced by the Prime Minister last night, that the only solution to COVID is through vaccination.
Thank you very much, Mr. Political Leader, for such a comprehensive explanation on all of the issues surrounding this matter. I will now give one final opportunity for one more question so that we can move on with our day. I'm cognizant of the media schedule, and I just want to make sure that I allow enough time. So are there any final questions from the press before we bring this press conference to a close? Okay, doesn't appear to be any. Thank you very much for your participation here today. Thank you all for listening on our various channels. Thank you to GDTV listeners. Thank you to Sky FM listeners. I also want to thank the Flabo Train Group. We know that you've been listening as well. We want to thank all of our supporters and everyone who joined on today via Facebook, and all of the various mediums on social media. Thank you also very much for your time, and thank you for being here with us. Thank you.
Recording stopped.